Here, pass me the pepper.
Oh, jeez.
That's how it's supposed to be.
Like this?
No, you gotta do it a little wetter.
Oh.
Sorry. Yo, I'm at the hospital. Yeah, they're hiring actors to help students practice diagnosing. Of course medical schools do that. At least the better ones do. Okay, talk to you later.
All right.
Okay, let's practice retching. Yeah,
Let's go. It's good.
Alright, so in your pamphlet you'll find the disease you've been assigned and the symptoms you'll need to exhibit. Thank you.
Bacterial meningitis. Jackpot.
Gonorrhea? You want to switch?
Sorry, buddy. This is the Hamlet diseases. Severe pain, nausea, delusions. It's got everything.
What about you?
Sure, yeah.
Wait, what do you got?
The surgeon left a sponge inside me.
Good luck with that.
It won't be that bad. Just step into the spotlight and belt that gonorrhea to the back row.
Yes. Yes, I will. I'm gonna make people feel my gonorrhea and feel the gonorrhea themselves.
Hi, I'm a medical student, and when I'm in DL, I need to diagnose a patient within 4 days, or they could die. For pretend.
Don't die on me, Oscar! Is that good?
So when a patient in your DL presents with burning during urination, vaginal and penile discharge, and blood in the urine, tell your preceptor it could be gonorrhea, and you could save lives. For pretend.
Alright, let's get started.
Okay, so are you experiencing any discomfort?
Only a little burning during urination.
Okay, any other pain?
The haunting memories of lost love. May I? Lights? Our eyes met across the crowded hat store. I, a customer, and she, a coquettish haberdasher. I pursued, and she withdrew. Then she pursued, and I withdrew. And so we danced. I burned for her, much like the burning I would experience soon after during urination.
Gonorrhea!
Gonorrhea!
Alright, so what would you use to treat this?
Ceftriaxone or cefixime.
Alright, what about the doses?
250 milligrams single intramuscular dose for ceftriaxone.
And 400 milligrams single oral dose for the cefixime.
Alright, and how do these antimicrobials work?
They bind to specific penicillin binding proteins located in a bacterial cell wall, preventing the cross-linking of peptidoglycan and inhibiting the last stage of cell wall synthesis.
Alright, and are there any other alternative antimicrobials?
500 milligrams single oral dose of ciprofloxacin.
400 milligrams single oral dose of fluoxetine.
Alright, and how do those work?
They bind to bacterial DNA gyrase, interfering with DNA replication and transcription. It prevents DNA from being supercoiled.
And if it's in a region where resistance isn't a problem, you can give 2 or 3 grams of ampicillin with 1 gram of probenecid, both given orally as a single dose.
Alright. So now for the million-dollar question, are there any resistance problems? Go.
And I guess that's when I finally understood. There was nothing to do but go.
What would you do if I sang out of tune? Would you stand up and walk out on me?
You know what I think? I think you're just a chicken. Cuckoo-ca-cha! Cuckoo-ca-cha!
That's what I was thinking.
Cuckoo-ca-cha! 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 Oh my god, this is priceless! Cuckoo-ca-cha! Cuckoo-ca-cha!
mechanisms.
Fine, I'll go since you're too chicken. First, the bug has a beta-lactamase, which will chew up most beta-lactam drugs. Secondly, changes in the penicillin binding protein of the organism offers low-level resistance, but is less effective than beta-lactamase production. These bugs are called PPNGs, which is short for penicillinase-producing Neisseria gonorrhea.
1 in every 400 people between the ages of 14 and 39 have gonorrhea. If the other 399 people had it, everyone would have gonorrhea.
The bacteria have also developed resistance to quinolones through mutations in the genes coding for DNA gyrase, which makes the gyrase less susceptible for the drug.
Well, Neisseria also has multi-drug resistance phenotype. It has an efflux pump that pumps out drugs. Erythromycin, tetracycline, chloramphenicol, rifampicin, and penicillin are some drugs that are pumped out this way too. In the end, the bugs generally acquire its resistance through mutations or from resistance factors through exchange of plasmids.
We just made light of a serious situation, but gonorrhea is not a laughing matter. In fact, if 1 billion people got gonorrhea every day for the next 7 days, every single person in the world would have gonorrhea.